Okay, everyone, this is going to be our TED Talk speaker for today, Dr. Qureshi. He works at Mission Hospital, so let's give him a round of applause.
Thank you, everyone. So I'm going to talk a little bit about my journey, my experience. So I want to start with this slide, a Datsun 210 and a dream. Anybody know what a Datsun 210 is? You're all too young? Okay, we'll get to it. The picture will come up. So my parents were were married in a small town in Pakistan in 1978. Very small town, has running water, and electricity would come and go. They got married in 78 and they had 2 kids, and by the early 80s they had an opportunity to leave the country. So they got on a flight and came all the way to sunny Southern California, where we've been ever since. And my dad was a chemistry major there in Pakistan. He taught chemistry as a professor, and my mom was raising 2 kids, my sister and I, ages 5 and 3. When we got here, we lived in a very small condo/apartment type unit, and 2 kids, rowdy, rambunctious, on the 2nd floor of a condo. Didn't really go as we had planned. Eventually, one day, we were asked to leave. That's where this comes in. We were homeless with nowhere to go, but we had this, our Datsun 210. We actually lived in the car. We actually lived in this car as my parents worked at a fast food restaurant, making food and cleaning dishes. That's what they did. They did that day in, day out. Make food, wash the dishes, stay in the car for a short period of time until they were able to kind of get on their feet. We couldn't afford a lot. Never went on vacation. I remember I had 2 pairs of pants, 1 pair of shoes that I wore until the soles were gone, and a couple of shirts and a sweater. And that was it. That's how we lived. In junior high, I started working at Burger King, and I worked there for years through college, helping me pay for extra expenses. But through it all, what kept me going was perseverance. It wasn't that I was born with privilege. It was that I had to keep moving forward. I saw what my parents went through. I saw what future I wanted for myself, and how could I get there? So what my day looks like. I'm a board-certified physician by 2 different medical boards. I have 4 different specialties now, and I work predominantly in the intensive care units at Mission Hospital. And what I do is we respond to all emergencies throughout the hospital, whether they're in the operating room, the emergency room, or the intensive care units. We take care of the sickest of the sick in the hospital. And the units that I work in, there are 4. The trauma intensive care unit, anybody with a traumatic injury, car accidents, shootings, stabbings, those types of things. I work in a cardiac intensive care unit, anybody with heart disease or heart surgeries that come out. I work in a medical intensive care unit, so somebody on life support or severe infections. And then finally, I work in a neurologic ICU, anybody with brain injuries. So I work there as well. So brain injuries could be large strokes, could be a hit and fall, could be something else in the brain. This is a typical sort of patient that we have in the ICU that you can see here. And what you see are obviously machines, and the rooms that we have are large, and they're typically filled with machines, filled with things that are keeping people alive. Here's another picture of a machine that's doing dialysis for the patient, and we have oxygen supplies and other things. What else do I do? It's a lot of decision making. It's a lot of trying to figure out, this is happening today. Which direction do we go? Do we take a medication away? And sometimes the answer is, maybe we do. Maybe we try it and see what happens. And if it works, that's wonderful. And if it doesn't work, we've got to pull back and try something different. And sometimes the answer is, I don't know. That's why there are so many physicians that we have and so many different specialties that we have in our departments that sometimes we're consulting with one another. On top of that, it's a lot of conversations with families and patients, a lot of empathetic conversations. People are really sick, and a lot of times they do well, but it's about helping families and patients sort of get through this difficult time that they have. And sometimes we're not giving such good news. Sometimes we're saying there's nothing more we can do, or we've done everything we can, and unfortunately, there's nothing more. In addition, I'm leading teams in the hospital. I'm focusing on safety as we move through these teams, and I'm teaching future doctors some of the other things that I do. On top of it, I do a lot of procedures, which I'm going to get to and go over with some of the things that I brought, some of the props. So the first one is intubation. What is an intubation? If someone cannot breathe, if someone is having difficulty breathing, catching their breath, no matter what sort of external devices that we put on them, and they still can't sort of get through that, what do? We put a breathing device in, and it looks like this. So what I'm gonna show is we put this camera in, we lift up the epiglottis, which is this little flap here, and you can see the vocal cords there. That leads into the lungs. We insert this device that goes in and blows up a balloon so it stays in your airway. So you can see the balloon blows up and that keeps the device and secures it in place. So we've secured it in multiple ways. We can ensure that this tubing here is connected to a ventilator. And so I wasn't able to bring one of those, but I was able to bring what we call an LMA that can go into the back of the throat and can allow air to be delivered in a very similar way. But this is basically what is coming out of the person's mouth. So you can see the diameter of this. I'll pass it around so you guys can take a look if you want to, or you can leave it there. What's the next sort of procedure that I might do? Once that tube goes in, we can use a device called a bronchoscope to do a bronchoscopy. So basically we're going into the airway with a camera, and this whole thing can go all the way in. And this is what it looks like with the camera on, looking at the vocal cords again. And there's a patient with a tracheostomy going through, looking at what the lung looks like inside. So how does it work? Whether you have that tube device that I handed out in place, this can go through there and go into the lungs. Alternatively, we do a lot of these procedures on patients who are not on ventilators. It's to help look at what's going on in the lungs, and it's to help clean up the lungs when there's a lot of mucus or they have trouble breathing. We also use it regularly. We can put other devices through it that help remove foreign objects. And then cases where patients have had little wheels of old Hot Wheels, like those tiny little wheels that you can imagine on those cars, aspirated a wheel when they were a child, was told they had asthma their whole life. Finally, in adulthood, got a CAT scan, got an imaging of the lung. We put the camera in, we were able to pull out that little wheel, and the patient's fine ever since. No asthma, no symptoms. Other things that we do are these things called central lines. Now, these are used for many different purposes, but basically what we're doing is we're numbing the skin on the side and cutting and putting one of these in. This is how long it is. You've got another one here. And what we use these for are life-saving medications that we can administer. This one here is actually used for dialysis, but a lot of times in the hospital, we're doing these for temporary dialysis, where we can put this device in and it goes really close to the heart, and then we can connect this to a machine. So we also insert these pulmonary artery catheters, and this entire sort of contraption can go into one of those IVs and then all the way through the different chambers of the heart. So here you've got the picture of what we're looking at, and up there is kind of what the surgical technique is. But this is what I've got in my hand, this device here. And it uses a technique where we blow up a balloon. It's got a balloon at the very end. And we use a concept similar to sailboats in the ocean, where when the sail opens up, the wind pushes. It's got a balloon at the end. We inflate the balloon and we allow the blood flow of the body and the active pushing that we do to allow it to float into the natural place it needs to go. So here's where it usually ends up. It's supposed to go through the different chambers of the heart and end up in the pulmonary artery. And what this allows us to do is monitor your blood pressure, monitor your heart function from inside your body rather than using devices from outside your body. I'm gonna take you somewhere that's high intensity. It's the code room. So this is where a code blue is called. It means that someone's heart has stopped and their breathing has stopped together. And a team rushes in, a team of doctors, nurses, pharmacists, just you name it, everyone's there. And what are they there for? We're all working diligently to save this person's life. They have no pulse, they have no heart rate. What are we doing? We're all working together, as you can see in this photo. And what we're doing is, those of you who have taken, has anyone taken a CPR class? First aid class? Yeah, a lot of you have. So with CPR, what's the first thing when you get to the patient, other than asking them if they're okay? Say it again? Chest rise. What else? Heart rate. Okay. So did they go over CAB or ABC? Did they talk about that? Airway, breathing, circulation. So what you see here is someone's doing CPR, focusing on the circulation, making sure that the heart is pumping from the outside so that blood flow gets throughout the entire body. On top of it, we're talking about airway and breathing. How do we ensure the airway? With one of these devices, right? Or an intubation. And then we attach an oxygen canister to it to effectively give enough oxygen. High stress environment. It takes a lot of practice and rehearsal. It's not easy. Even those who have taken the CPR class, it's sort of simple when you're in the class. It's really difficult when you're actually doing it. And we rehearse this a lot to make sure that we get it right without any issues. And the key with this is it's all about practice, practice, practice. We don't want panic in that room. Have you ever seen this device? So it's called a Lucas device. Someone said yes. So a lot of the emergency medical companies, when you call 911, the ambulances or the firefighters have this device. And what this does is it straps behind you and connects and basically administers CPR for you. So I'll talk about how I got to where I got. So in high school, I worked really hard, did a lot of volunteer hours, did a lot of research as much as I could. And when I graduated at the top of my class, valedictorian. So yay, celebration, right? But it doesn't always end there, right? So I graduate and I figure, where do I go to college? I applied at Chapman here. That was my top choice. I went to Chapman. Liberal arts college. It's a lot of hard work. And I'm trying to figure out, what am I going to do with my life? My major was biology, but at the same time, I didn't really like sitting in class looking at cells. It wasn't something that was exciting to me. I had to kind of go through and figure out, where do I go next? I took a lot of psychology classes. I took a lot of liberal arts classes. I had 2 minors on top of my major as I kind of got through the process. And by the time I graduated, I got the Cheverton Trophy, which is basically their version of being the valedictorian, which is the highest honor you can get there. So I figure, okay, this is great. My grades are good. I've done a ton of research, right? I got all this, publications. I had like 3 or 4 publications. So I'm like, this is great. Took the MCAT and I figured, okay, I'm gonna apply for med school. Rejected. I was waitlisted at 2 schools. The waitlist just continued and ultimately they said, we're sorry, we're not gonna move forward with your application. So it's pretty crushing, because you can imagine, those of you that are working hard, so I hope none of you do, but I got rejected. And so that was pretty crushing, because what do you do next? I had a choice to make. Do I rethink what I wanna do? Do I try to go in a different direction? Do I retake the MCAT and think that maybe that'll get me somewhere? Or do I take a different path and go to the Caribbean, which is what I ended up doing. So you can see how beautiful this is, right? Yeah, it looks beautiful from the outside, but not from the inside, right? Because you're studying nonstop. Really well maintained, very modern, on Grenada. So I decided to go because I said to myself, I can take another year, I can take another 2 years. There's no guarantee. I may end up here anyway, I may end up somewhere else, but do I really take that chance? And for me, it was about minimizing the time that was wasted. So I decided to take that chance. It was 2 years on the island, sort of back and forth. Summers we had off, but 2 years on the island where we worked diligently. We learned whatever we could in the books, and then also in our anatomy lab with professors sort of in a classroom setting. And then 2 years in the hospital back in the US. So 2 years abroad and then 2 years back. I started in California, and then I felt like California was, I was learning only one way to practice. I decided to go to New Jersey to learn a different way to practice. And medicine is practiced differently with nuances wherever you go in the country. And those of you who decide to go this pathway of medicine, in whatever aspect that you do, you'll see that. So after 2 years of my hospital sort of rotations, learning as a medical student in the hospital, learning what to do, what not to do, but not really hands-on, because you're still a medical student and you've got to let the other doctors that are learning be more hands-on. So you get some hands-on experience, but not all. After that, it's time for graduation. And so you graduate and you think, okay, now what's gonna happen next? Immediately after graduation, or shortly after, I got married. And after that, I started my residency. And these were the 6 longest years. So I did 3 years of residency, 3 years of fellowship. We had 2 kids, and ultimately we had to come back. This is actually a picture of our flight coming back from Florida. I went to the University of Florida for my residency and fellowship. My first job at the University of Southern California as an assistant professor. There I taught residents, taught fellows. I took over an ICU. There at my first year I got Teacher of the Year, which was amazing. And one of the things that I felt coming here was I brought the knowledge from somewhere else, from Florida back to California. And for the students and some of the professors there, it was sort of brand new knowledge for them. Even though they knew it all, it's sort of a new approach, a new way to do things. And I think that's one of the reasons why I got Teacher of the Year. Ultimately left LA, came to Orange County. So in the spirit of TIDE, we want to talk about all the aspects of TIDE. Technology. This is what we call a robotic bronchoscope. So you see this. This is sort of the first or second generation, and this is the new generation. The robot holds the device in place. The robot uses 3-dimensional mapping to get to different targets. And what we can do with this is we can biopsy and diagnose cancers in the lung. We can also treat them. We have a device called Aaliyah that you can put into the airway and you activate it with heat, and it causes destruction, local destruction, and in a way causes the whole body to have an immune response and help kill the cancer. Here's another device, an ultrasound. Seems simple. We use them all the time. We use them day in, day out for a lot of these IV lines that we put in the neck and arterial lines that we put down here. We use the ultrasound. This is the old type. It stands about this high, and you can see how large it is. This is new. So it's as big as your phone. It just connects to your phone. It gives you amazing picture quality. We use lean methodology, and what we're really looking at is how do you find value? How do you reduce waste, right? How do you improve and optimize flow? And we're doing this all the time in the hospital because our space is limited, but our patients are not. We're constantly getting an influx of patients. We've got to decide, how do we maximize the space that we have? Designing systems that protect people. We are building a third tower at our hospital. It's going to cost over $100 million to build this third tower. It should be built in about 4 years from now. So we're actively going through the process of excavating at this time. But one of the areas that we were tasked to be involved in as intensivists and ICU doctors is, how do we design your intensive care unit so that we minimize patient movement, we minimize risk to your patients? We don't need to take the patients so far, especially when they're unstable and anything can happen. And then entrepreneurship. In 2022, I got my MBA, executive MBA, so that I could see for myself what else is out there. Yes, I can see patients, and I see patients all the time. What I do is I work with two different companies. I work with a company that's called SMS Biotech and a company that's called Concur Biophotonics. What does SMS do? It uses stem cells from our own blood. You pull your own blood, adult blood or human blood out, and we find these little cells called SMS cells, small mobile stem cells in our own blood. And what we're using it for technology-wise is to regenerate lung tissue for people who have lung damage from smoking and other diseases. And then over there, we're looking at devices that we can insert into the lung. For example, I put this in, or that robotic camera, we put it in and it looks like a tumor. Well, we need to get a piece of it, a biopsy of it, and then wait 3 days to get an answer. With that device, or what we're working on is, can we touch that device against tissue and know what we're dealing with? So with that device, what you can do is it uses fiber optics, and you can touch it and it'll say, this is cancer cells and these are not cancer cells. So what are the things that I've learned? From nurses, it's about staying calm in the chaos, because you have to. From my mentors, hold the line, even when nobody else does. Do what's right. Do what's right for your patient, do what's right for what you're doing. From my parents, keep going. Even if the doors close, you've got to keep going. You can't stop. And so how do you start? Rise. You guys all know Rise? So on yourself and with your community. Thanks, guys.